our topic today is going to be how to manage toxicity at workplace when you are being bullied. So this video is not to spread negativity, but it's to prepare your mind as a new graduate, as a new nurse, to know that such things do exist. This has been in existence for more than 30 years in the nursing industry. But if you know how to manage it without feeling like, oh, maybe you have problem or maybe people don't like you, no, it's not about you, it's about the system. So if you're able to manage it, you will not feel depressed and you'll be effective at work. So guys, let's jump straight into this video. Hi everyone, you're welcome back to my channel. So in today's video, I have a special guest in the house. I've been following her for a while. She has very interesting content that drew my attention. So I will let my guest to introduce herself.
Hello, everyone. So my name is Kendra. I am a registered nurse and I live in the United States. I have been a registered nurse for, it's 12 years. 12 years, yes.
Wow.
Initially, I never wanted to be a registered nurse. My mom made me go to nursing school because being from the Caribbean, they either push you towards some kind of medical profession, if not law, or then maybe like finance. So she told me I was going to be a nurse. So that's how I ended up becoming a registered nurse. And that's pretty much it.
What should we look out for before working in any facilities? What questions should they ask employer before they take up the job offer?
Right. So the first thing that I like to tell nurses who are just entering the profession, who have their license and they're getting ready to practice, is that you have to have a 1-year goal and you should also have a 5-year goal first before you enter into any facility. Because long term, you would need to know, okay, in 5 years, I probably want to be a nurse practitioner. I want to go into anesthesia. I want to go into mental health, or I want to own my own business of some sort. So I first say you need to know yourself first, your goals.
Okay.
And then things you want to look for in a facility to support your goals. For example, do you prefer a large teaching institution or a smaller teaching institution? If you're interested in going back to school, does the institution give you tuition reimbursement? If they provide tuition reimbursement, what are the conditions of me working? When I finish school, do I have to stay on and work with you commit to you for 3 or 4 years? So those are the things you need to look for. I also think now that we're in the digital era and there's so much information out there via Facebook groups, there's so many different platforms. I think it's within a nurse's best interest to go on those platforms and kind of read and see what other nurses are saying about specific institutions and specific healthcare systems. Because you'll hear things, you know what I mean? And sometimes there's a common theme amongst institutions that you're like, I just want to stay away from that institution. Another thing, I guess, also is, like I said, related to your goals. Do you want to teach in a teaching hospital or do you prefer community hospital? So I always encourage nurses to evaluate what their goals are first, because the whole aim is not to give your life away to someone's job in someone's institution. You have to go into the workforce with your goals in mind, so that way you can use the institution as a stepping stone to get to the next step. And that is the information I wish. This is the kind of information that I wish, before even stepping foot into a hospital, I wish someone had given me this kind of advice. And I wish I also had mentorship to think in that manner. Like, what are my goals? So that's what I was
that's a great point there. Is the nursing industry really toxic? I could remember when I was much younger, I had this feeling that nurses in particular, they are the aggressive type of people. But despite I love this profession, but I had that within me. So being that you've been in this profession for like 12 years, so what's your take on this?
Nursing, definitely, there is some toxicity that you'll encounter in nursing. But based on the videos that I've posted, I'm also hearing that the toxicity runs rampant in many other industries. But specifically for nursing, I think a lot of it stems from the educational level, even within academia and going to nursing schools. They make it so competitive. They make it as if it's this goal it's attainable, but you have to fight so hard to get it. So I think everyone is in this competitive mode. that once you finally get there, you have a bunch of competitive people, and everybody wants to show you that they know what they know. Everybody wants to show you that I know how to do this. I can get this done. I'm better at this, or let me try, or, looking for all the accolades. A lot of people will say too that nursing is a female dominated field, and that's the
Mhm.
reason why we have so much toxicity. And I know, as bad and as misogynistic as it may be, I kind of believe that is because it's so many women. And they always, there's a saying that I say this to my daughters. I'm like, two queens can't live in a castle, right?
Yeah.
Two queens
Yeah.
can't live in a castle. So it's like that kind of situation. However, though, I think that there's been a lot of improvement throughout the years. I think
Mhm.
the bullying and the toxicity was much worse in the earlier years. And I think the reasons why it has improved is because there's been a lot of research into it. It's a topic that's being talked about more often. And then also, too, institutions are realizing that people can take the legal route and be
Mhm.
successful legally if in fact they're working somewhere and the toxicity and the just the negative environment affects their mental health. It
Mhm.
affects them from advancing. So I think it's being taken a lot more seriously, even though it's continuing, because
Mhm.
it's being talked about so much.
Yeah, I experienced that when we had one of our hospital practical in, I think, internal medicine. There's this set of nurses that they just really don't want to work with us. It's not all
Hmm.
about being black or white, but I think that is just their kind of person. Why
Hmm.
there are some nurses that they will just want, okay, yeah, join me, do this, do that. Some they just want to, like, you make my job slow because I have to teach you.
No, definitely. And I also think too, going into nursing, I will say nurses, who are new to the profession, you need to be very reflective. You need to look and see what's your personality type.
Mm-hmm.
And it's important to think about ways of how you're going to handle these tough situations. You have to sometimes fake the confidence. You have to
Okay.
not be afraid to speak up for yourself in situations. And the
Mm-hmm.
best thing I can advise new nurses is whichever facility you're going to work in, you have to become familiar with the policies, because
Okay.
that will help you in speaking up for yourself. Speaking up for yourself, if someone is rude to you, it's okay to pull that person aside and say, in a polite manner, hey, I didn't appreciate the way you spoke to me earlier. Is there something going on? It's a profession, so we have to call people on their bad behavior in a professional manner. And I think that's okay. I would say, as an instructor, I have taken students onto the clinical site, and I've had nurses give me dirty looks, or, oh, I can't be bothered with the student today. And I'm just like, okay,
Yes.
that's fine. But for the next 6 weeks while we're going to be here, I'll never assign any of my students to you. And because my students don't need to encounter that. When you're new into the profession and you're trying to learn, you don't need to have that kind of attitude to deal
Yeah.
with.
Have you been bullied during your 12 years being a
Mhm.
nurse? Were you able to handle it?
Many times. But I'll be honest with you. I think because I worked as a nursing assistant in the nursing field in the hospital already, I was
Mm-hmm.
already building up that confidence of knowing how to handle situations, because I
Okay.
had been in it as a nursing assistant. So I would watch the nurses' interactions.
Mm-hmm.
Even in, and people think bullying is this thing where the person has to be aggressive towards you and hostile and yelling and carrying on with
No,
you.
no, no.
No, bullying can be very subtle, because
Yeah.
it can be in the exchange of, I mean, I'm pretty sure you've seen in your clinical, I don't know, where
Yeah.
nurses are exchanging a report, and you can see some rudeness coming from one of the nurses, or you can sense
Mm-hmm.
some attitude. That is a form of bullying, because what you're doing is using that as an opportunity to intimidate the nurse that's coming or the nurse that's going. I have been in instances where, yes, I've had to speak up for myself several times, and not only just from nurses, but also from like physicians,
Mm-hmm.
who will ask you to do things or say certain things. And I just have to say, excuse me,
Mm-hmm.
the one thing that I tell you, the reason why I'm never afraid to speak up for myself when it comes down to bullying is because my mom, I told you, she made me go to nursing school, right? And her
Yeah.
whole thing was, you're in the US and there's all these different states that you can work in. And she's like, you have an RN license. She said, once you have an RN license, she said, nobody will be able to treat you badly. Because she said, if they do something to you at this one institution or this one place or whatever, you can always leave and go find yourself another job. So she
Okay.
instilled that in me. And that kind of empowered me. Like, I'm not going to let anybody take advantage of me, because I have a skill that's usable throughout the world. I'm not going to let you talk to me in any kind of way. You know what I mean? So
Yes.
there's something, I think Oprah always says it, you have to teach people how to treat you. And by
Mm-hmm.
standing up for yourself,
Mm-hmm.
that's the best way. I posted that story where I told you I was new to the ICU, and
Mm-hmm.
I didn't even
Yeah.
really give full details, but the nurses there in the beginning, they were terrible. It's like they wanted to see you drown. They wouldn't even, help you. Or if they're giving you feedback, they'll criticize you in front of a group of people. So that's the kind of
Oh.
bullying I've experienced. And also to in shift report, we have 12 hours to get the work done. There's only so much you
Mm-hmm.
can do in 12 hours, right? So it's
Mm-hmm.
like you're given a report, and the nurse you're giving a report to is asking you, why wasn't this done? Why wasn't that done? Are you going
Mm-hmm.
to do that? Well, you need to go back into the room and draw the blood. You need to go in the room and do this. You need to go in the room and do that. And I have to say, no, I'm not going back into the room. I told you the reason why this couldn't get done. Nursing is 24 hours. You're not
Mm-hmm.
doing me a favor by completing the task. You're taking care of the patient. So if
Mm-hmm.
I didn't get a chance to draw the labs because I was busy doing something else, and by all means, I really genuinely didn't get a chance to do it, I'm sorry, you're going to have to. Oftentimes, I think because I think the way that I present, I speak confidently. Even if I'm afraid, I'm going to put on that
Mm-hmm.
front, like I'm not having it or whatever. So I've noticed that people tend to tread lightly when it comes to
Mm-hmm.
trying to bully me.
Wow,
I'm
because
not
of the
timid.
confidence.
I'm
Yes.
not timid at all.
Mm-hmm.
So,
I have this important question to ask.
mhm.
Have you previously, because there's a video of yours that I watched talking about having a medical error. How were you able to resolve that?
So the thing is, I have always prided myself on having good relationships with my colleagues, even the
Okay.
physicians.
Mm-hmm.
I make sure that I'm respectful of my colleagues. And so when that happened, the thing is that there's this, I guess, a framework, and I forget who created the framework, but it's called Just Culture. It's
Okay.
here in the US, and I don't know if you've ever heard of it. It's called Just Culture. And
No, no.
basically, Just Culture says that to err is human, meaning that
Mm-hmm.
as human beings, we're going to make errors, right?
Yes. It's,
So is that error being made because you're completely negligent? Or was it a
mm-hmm.
systems error, right? Because usually in the past, the first thing would be is to blame the individual why this error happened, or you caused it, you finger point and blame
Mm-hmm.
you. But over time, they found that, well, you know what? That's not necessarily the case. It's
Mm-hmm.
the system. So the time when I made the med error, I know it was my fault because I should have used the example that I gave the one time. I
Mm-hmm.
infused the vancomycin too fast because I was rushing. I
Mm-hmm.
was so hungry. I was so like anxious. It was like close to 4 o'clock in the afternoon. I hadn't eaten. I don't even think I had used the bathroom yet for the day. So I
Mm-hmm.
was rushing to go to lunch, and I programmed it incorrectly because I didn't use the library. So I bypassed the system, the safety check that was in place. But also too, the pharmacy missed it, the doctor missed it, and because
Mm-hmm.
there was no real harm done to the patient, like
Yeah.
it wasn't any malicious intent.
Mm-hmm.
You know what I mean? Because the
Mm-hmm.
whole thing is they understand mistakes can happen so long as you come and you say, hey, I made an error. So the best thing is never to cover it up. Never
Yes.
try to cover up a medical error. I had a
Yes.
friend one time who tried to cover up a medical error, and she actually got terminated because they
Wow.
said, we understood that you made a mistake, but the fact that you tried to cover it up is what is the problem. Is the
Okay.
problem. You know what I mean? So
Mm-hmm.
long as I think long as there isn't any, sentinel event, and even if there's a sentinel event that occurs, they still would look at it as you didn't mean for this to happen. Mistakes happen.
Mm-hmm. Yes, it
As
does.
as nurse, I always try to say, try to minimize the distractions whenever you're preparing your medications. Um,
Okay.
Try not to rush. Like for me, when I made that error, I was rushing. I was rushing to get off the
Mm-hmm.
floor to go eat. And then in that same video, I talked about when I mislabeled the blood and I sent
Yeah.
the different bloods on the two different patients.
Yes.
Theoretically, I should never be doing a blood
Mm-hmm.
transfusion on two patients at the same time. So
Oh.
that was a systems error, meaning that I was the one that got the admission. I was
Mm-hmm.
already doing a blood transfusion on the patient that I had, but the patient
Mm-hmm.
that was coming to the unit was an upgrade, needed a higher level of care, and they also needed blood. And I was the only nurse available to take it. So that put me in a place where I was transfusing two patients. And it's very easy to get things confused, and I did just that. That's why they say if you have a blood transfusion with one patient, you should never transfuse another patient because you're busy, phone
No,
calls,
yeah.
everything is going on, the patients are calling, the family member has questions. You can, easily make an error that way. Another thing I want to say is that when you're working as a nurse, you have to be able to speak up for yourself, even when dealing with family members and patients. There's been times where I'm in a room and I'm trying to prepare the medicines and I'm calculating, and the family members in the back, and yep, question after question. I have to tell them, I need 5 minutes.
Mm-hmm.
I need to concentrate on what I'm doing here, or like I'm trying to hang something and I'm punching the numbers into the IV pump, and the patient is like, oh, I need this, oh, I need that, and I have to tell them, can you please stop until I'm finished, because if you keep talking, you're going to distract me. I'm going to make an error. I need to focus on what I'm doing. So a big part of nursing is not only being able to advocate for your patient, but also advocate for yourself. I need a minute, please. Like, could you stop talking? Or no interruptions at this time, please, because I'm trying to prepare my medicines. You have to speak up because it's very important to limit interruptions when you're preparing medications.
The last on my question is what's your advice for nursing students, new graduates? What advice do you have for us?
The best advice I wish that I knew this coming out of nursing school is that even though, regardless of all of the negative information that we're seeing on the different platforms regarding nursing,
Mm-hmm.
nursing is a great profession. And I
Mm-hmm.
remembered one of my nursing school professors telling the class, nursing gives you the ability to change your generation. Okay. Because as a nurse, you have the ability to work. Okay.
Mm-hmm.
You have a skill. Your skills are needed. You have your hands. That's what you're using, your hands and your brain, right? But it's a skill that once you have it, you will always be able to earn a living. So that's the first thing. I think nursing is a great profession and it's a good choice, right? The thing is, you have to be strategic and you have to have a plan. Because what I will say is that dependent on where you're working, like if you plan to come to the US and work as a nurse, it is not sustainable long term to work at the bedside. To
Oh,
be
why?
in direct care at the bedside, unless you're in a unit such as maybe the NICU, where you're taking care of the small babies, or you're in labor and delivery, or maybe, well, not even so much labor and delivery, because pregnant women are so sick now these days.
Mm-hmm.
It is not sustainable to be in direct care because they keep adding more and more and more onto nurses, that the
Mm-hmm.
burnout happens really fast. So it's
Oh,
not
wow.
sustainable. So it is very important, I think, in these days to have a plan. I think nursing, I don't think it's going to be anymore where you'll find nurses at the bedside for 20 plus years, because it's
Yeah.
harder today. It's not happening. You know what I mean? So I
Mm-hmm.
always like to tell, nurses who are new to the profession is have a plan. Like I always said, a 1 year goal, 5 year goal, and 10 year goal. Nursing
Mm-hmm.
can be used as a stepping stone into so many other things. And there's so many different avenues that you can go into nursing. A
Mm-hmm.
lot of it is not taught in nursing school itself. Usually they teach you and the first thing you think you have to do is step foot into a hospital. And it all depends on what you want to do, but you really need to have a plan because it's not a sustainable career. At least not here in the US. I don't know for other countries. Maybe other countries the profession is respected a little bit more, but here it's almost as though nurses have very little respect from the higher ups in the institutions. They don't care. They'll
Wow.
pile and pile and pile onto us. And we're just expected to absorb all of the weight that they're putting. And we're
Mm-hmm.
just supposed to make it work. Do more with little. Like right now, sometimes I go to work and I don't have a nursing assistant. So I
Wow.
am everything to the patient. I have to do all of their vitals. And, I have to do all of the ADLs. I have to make sure and do their finger sticks in addition to pull the trash. Sometimes there's no housekeeper. We pull trash.
Wow.
I clean my patient's room, things like that. Go get coffee, go get food for the patient, things like that. So it's not sustainable. Have a long-term goal, have a backup plan.
Wow.
Always have a plan B and C.
Yes, in Africa,
Mhm.
there are sometimes you see in hospitals, like private hospitals, you see like 100 beds, you find out that you only have like five nurse patients
Wow.
everywhere, and the nurse is gonna work, the nurse is cleaning, the nurse is running errands, the nurse is doing like virtually everything. And same in Poland, I had a Polish friend, so he asked me, he said, okay, you're a nurse student, so do you plan working in Poland? I said, I don't know. That was when I came in newly. He said, please don't work here because you're going to regret it. I said, why? He said, because the nurses here are working their ass out. They are not respected, they are underpaid. So I should just go to a better country to work. So I think it's everywhere.
It's
Thank
everywhere.
you for coming to my channel. I really appreciate your time. So guys, if you want to check out Kendra's channel, she's a very big time YouTuber. I'm so amazed. I'm so special for she accepts my invitation to be a guest in my channel, and I really appreciate your coming to my channel.
I appreciate you too for reaching out. Thank you so much.
So guys, bye.
Bye.